A very good morning to all of you. Am I audible to all of you? Yes, am I audible to all of you? Am I visible? Yes, am I visible to all of you? Okay, now today we will study about the plasma proteins, dysproteinemias, and acute phase proteins. These topics are very important for your clinical aspects. Am I visible to all of you? Please write in the box. Am I visible to all of you? Yes, now I am visible. So I am again launching the class. And am I audible? Please write in the box. Okay, so let's start with the today's topic, that is plasma proteins. It includes plasma proteins, dysproteinemias, and acute phase proteins. Am I audible? Am I visible to all of you? Please write in the box. Once again, good morning to all of you. What is plasma and what is serum? What is the difference between plasma and serum? Please write in the box. Please write in the box what is the difference between plasma and serum. Yes, Sakshi, Monica, please write the difference between plasma and serum in the box. Yes. Total blood volume is about 4.5 to 5 liters. Okay. And about 55 to 60% of blood is plasma. Is it clear? About 55 to 60% of blood is plasma. Plasma is the clear straw colored fluid portion of the blood minus its cellular contents. So please write the cellular contents, name the cellular contents or elements of blood. Please write in the box about or name the cellular elements or contents. Yes. These are RBCs, WBCs and platelets. Okay. What is serum? Serum is a plasma minus clotting factors like fibrinogen and prothrombin. So this is an important line. What is serum? Serum is plasma minus clotting factors like fibrinogen and prothrombin. The defibrinated plasma is called serum. So we can say the defibrinated plasma is called serum. Is it clear? Have you understood the difference between plasma and serum? Please write in the box. Plasma is blood minus its cellular elements and serum is defibrinated plasma, or we can say plasma minus clotting factors. So this is the composition of plasma: water, solids, this clear straw colored fluid portion of blood minus its cellular element. This is plasma, around 55%. This is plasma. Solids around 9%. In this solid, around 7% plasma proteins, inorganic substances 1%, and other organic molecules like carbohydrates, fats, non-protein nitrogen substances, and hormones. So these are the components of plasma. As I said earlier, water is approximately 91%, and then organic and inorganic 9% and inorganic 1%, and total organic 9%, in which albumin 7%, globulin 2.7%, fibrinogen 0.3%, and other organic around 2%. So these are the components of plasma. Major portion is water, around 91%. So plasma proteins, the concentration of total plasma in human plasma is approximately 6 to 8 gram per dl. Here, please remember the unit of total protein. This is the proteins of plasma are a complex mixture that include not only simple proteins but also conjugated proteins such as glycoproteins and various types of lipoproteins. You all know about the conjugated proteins. You have studied under classification of proteins, these conjugated proteins like glycoproteins and various types of lipoproteins. The plasma protein consists of albumin, globulin, and fibrinogen mainly. Albumin 3.5 to 5 gram per dl, globulins 2.5 to 3.5 gram per dl, and fibrinogen 200 to 400 milligram per dl. So albumin globulin ratio, AG ratio, is usually between 1.2 ratio 1 to 1.5 to 1. Almost all plasma protein except immunoglobulins are synthesized in liver. This is the important line, that almost all plasma protein except immunoglobulins are synthesized in liver. Please write the examples of immunoglobulins. You might have studied in microbiology, except immunoglobulins. Immunoglobulins. Please name some immunoglobulins. Yes, IgG, IgM, IgA. Okay. Yes, am I audible to all of you? Okay, okay, good. So major plasma proteins are albumin, globulins, and fibrinogen. Almost all plasma proteins except immunoglobulins are synthesized in liver. So these are the common serum proteins, their functions and changes in diseases. These are the proteins, these are the molecular weight of these proteins, functions and characteristics or characteristic changes occur in various diseases. First, pre-albumin, or we can say transthyretin. This is an important protein, important plasma protein. Please remember pre-albumin and transthyretin. Function is thyroxine transport. Albumin, you all know, osmotic pressure regulation, general transport. We will discuss it later. Then next category is alpha globulin. These are albumins. These alpha globulins. Further, it is classified into alpha 1 and alpha 2. So these are alpha 1 globulins, thyroxine binding globulins, alpha 1 phytoprotein, alpha 1 protease inhibitor, alpha 1 acid glycoproteins. Or we can say orosomucoid, alpha 1 antithrombin, third, alpha 1 lipoproteins like SDL. These are alpha 1 globulins. Alpha globulins are further classified into two, alpha 1 and alpha 2. These are the changes which occurs in various diseases. We will study one by one. Next is alpha 2 globulins. These are alpha 2 globulins, alpha 2 lipoproteins like VLDL, alpha 2 macroglobulins, ceruloplasmin. Please remember, ceruloplasmin comes under alpha 2 globulins. Hepatoglobin protein C. Beta globulins are further classified into beta 1 and beta 2. These are beta globulins like beta 2 lipoproteins, transferrin, ferritin, hemopexin, complements, C3 complement, C4 complement. This is an important protein because it comes under acute phase protein, that is C reactive protein. C reactive protein, we will discuss it later in detail. This is C reactive protein. Plasminogen, very important, and fibrinogen, you all know. These are beta globulins. Another important category, that is gamma globulins, gamma 1 and gamma 2, immunoglobulins G, IgG, you all know, IgA, IgE, IgM, and light chain Bence-Jones protein. So these are important immunoglobulins, or we can say gamma globulins. You will study in microbiology about these immunoglobulins or gamma globulins. IgG, IgA, IgE, IgM, and Bence-Jones protein. IgG, you all know, major antibody formed in response to infective agents, toxin. Then IgA, you all know, secretory. IgE, antibody present in condition of allergy. IgM, response to. So these are the diseases in which these IgGs are increased. This is the another way to represent these plasma proteins and their major functions. These are the proteins, these are the plasma concentrations, these are molecular weights, and these are the major changes or occurs in various diseases or the major characteristics. So pre-albumin, alpha-1 globulins, alpha-2 globulins, beta globulins, gamma globulins, all are present in this table. Fractions of plasma proteins. This is the important slide because it incorporates all the important and major fractions of plasma proteins like albumins, albumin, pre-albumin, that is also called as trans-thyretin. It is an important albumin. This is pre-albumin trans-thyretin. So please write in the box what is pre-albumin or what is another name of this pre-albumin. Please write in the box. Please write in the box what is pre-albumin. Okay, trans-thyretin. What is the function? What is the function of this trans-thyretin? Please write in the box what is the function of this trans-thyretin. As I earlier told you in the previous slide, this is important for transport of thyroxine. Yes, this is here. Thyroxine transport. Alpha-1 globulins, thyroxine, binding globulins, transportin, alpha-1 acid glycoprotein, alpha-1 antitrypsin, alpha-1 lipoproteins like HDL. What is HDL? HDL stands for, please write in the box. HDL stands for, yes, Shashank Singh, what is HDL? Shashank Singh, Rakesh, what is HDL? Neha, what is HDL? HDL stands for, yes, Neha, Nisha, Ramlal, what is HDL? Yes, high density lipoproteins. Alpha-1 phytoproteins. Likewise, alpha-2 globulins are hepatoglobin, second is macroglobulin, and very important, you all know ceruloplasmin. So hepatoglobin, this is hepatoglobin, macroglobulin, ceruloplasmin. These comes under the category of alpha-2 globulins. Next is beta globulins, transferrin, hemopexin, lipoproteins like LDL, fibrinogen, very important, C-reactive protein, as I earlier told you, this is an active phase protein, this C3, C4 component system. And lastly, this gamma globulin, you all know IgG, IgM, IgA, IgD, and IgE. So these are the important fractions of plasma proteins. Alpha-1 globulins, alpha-2 globulins, beta globulins, gamma globulins, and albumin. So globulins are categorized into three: alpha-1, alpha-2, alpha-1, alpha-2. These are alpha globulins and beta globulins and gamma. Alpha, beta, and gamma, and alpha is further divided into two: alpha-1 and alpha-2. So have you understood this? Albumin, globulin, and globulin is further classified into alpha, beta, and gamma, and alpha is further classified into alpha-1 and alpha-2. Separation of plasma proteins, salting out method. This is a method for generally used for separation of plasma proteins. Fibrinogen, albumin, and globulins. By the use of this method, we can separate these plasma proteins, fibrinogen, albumin, and globulins, by the use of varying concentration of sodium or ammonium sulfate. Electrophoresis, you all know. By this electrophoresis, we can separate or we can get these 5 major fractions of plasma proteins: albumin, alpha-1 globulins, alpha 2 globulins, beta globulins, and gamma globulins. As I earlier said, albumin, globulin, alpha, beta globulin, and gamma. So these are alpha globulins, beta, and gamma. 1, 2, 3, 4, 5. Now, is it clear to all of you? 5 major fractions of plasma protein. Please write in the box. Is it clear to all of you? Sorting out, most proteins are less soluble at higher salt concentration. This effect is called as salting out. The salt concentration at which a protein participates differ from one protein to another. Hence, salting out can be used to fractionate proteins like albumin, globulins, and fibrinogen. Another process which is used for the separation of plasma protein, that is electrophoresis. You will read in the practicals in detail. This is albumin, this is globulin, alpha 1, alpha 2, this is alpha globulin, this beta globulin, and these are gamma globulins. What are the functions of plasma proteins? First and foremost important is blood coagulation, you all know. Second important is maintenance of homeostasis like pH and osmotic pressure. Albumin is the most important protein for this purpose. Defense against infection, you all know, all immunoglobulins. Then transport of hormones, nutrient, drugs, metabolites, and metabolic waste products. Important protein is again albumin. Most are synthesized in liver. Exceptions are gamma globulin, you all know, these are synthesized in plasma cells. So what is the exception of the synthesis of plasma protein? Plasma proteins are mainly synthesized in liver, but which protein is synthesized in plasma cells? Please write in the box. Which plasma proteins are synthesized in plasma cells? Please write in the box. Yes, gamma globulin. Jyoti, please write in the box, Jyoti. Tarun, please write in the box, Tarun. Sunita Gadwal. Sunita, am I audible to you? Please write in the box, Sunita. Okay. So, most are synthesized in the liver. Exception is gamma globulins. Synthesized as pre-proteins or membrane-bound polyribosomes, they are then subjected to post-translational modification. You all know in ER, it is endoplasmic reticulum and apparatus. Almost all of them are glycoproteins except albumin. This is an important factor, that almost all of them are glycoproteins except albumin. They have characteristic half-life, that is example albumin 20 days in humans. Major function is transport of various compounds by plasma proteins like fatty acids, bilirubin, hormones, calcium, heavy metal, drugs, etc. are transported by albumin. This plasma protein albumin. Thyroxine, you all know, is transported by prealbumin, or we can say transthyretin. Retinol, vitamin A is transported by retinol binding protein. You all know. Thyroxine again is transported by thyroxine binding protein, that is TBG. Cortisol and corticosteroids are transported by transcortin. This is also called as cortisol binding proteins. Hemoglobin, you all know, is transported by hepatoglobin. This is an acute phase protein. Then free heme by hemopexin. Then iron by transferrin. Cholesterol by HDL and LDL. That is high density lipoprotein, and LDL low density lipoprotein. So now is it clear to all of you? This is the compounds. These are the compounds transported by various plasma proteins. Important is thyroxine, albumin, you all know, fatty acid, bilirubin, hormones, calcium, heavy metals, drugs. Iron by transferrin, Then hemoglobin by hepatoglobin, transcortin transports cortisol and corticosteroids. Another category of plasma proteins are acute phase proteins. These proteins are very important for the diagnosis of various diseases. So, acute phase response or acute phase proteins. These are two terms, acute phase proteins, and these are acute phase proteins. So, acute phase response refers to a non-specific response. Please remember, this is a non-specific response to the stimulus of infection, injury, various inflammatory conditions affecting tissue or organs, or cancers, etc. So, acute phase response is a non-specific response to the stimuli or to the stimulus of infection, injury, and inflammation. These are three eyes. We have three eyes: infection, eyes, eye, infection, injury, and inflammation. So, infection, injury, and inflammatory conditions. And another is cancer. This phase is associated with a characteristic pattern of change in certain plasma proteins, collectively referred as acute phase proteins. So, this phase is associated with a characteristic pattern of changes in certain plasma proteins, collectively referred to as acute phase proteins, like alpha-1 antitrypsin, ceruloplasmin, complement protein, C-reactive protein, CRP, and many others. So, this is called as APR, this acute phase response, and this is APP, acute phase proteins, proteins which are involved in acute phase response. It is called as acute phase proteins. Now is it clear? The proteins which are involved in APR, it is acute phase response, are called as acute phase proteins. So now is it clear to all of you? Please write in the box what is APP and what is APR. So we can say the proteins which shows the acute phase response are called as APP. Am I audible to all of you? Please write in the box what is acute phase protein, or what are acute phase proteins, or what is acute phase response. Please write in the box. Okay. So acute phase response refers to a non-specific response to the stimuli of infection, injury, and various inflammatory conditions, and cancer. And the proteins which are involved in this acute phase response are called as acute phase proteins, APP. Examples are antitrypsin, ceruloplasmins, complement proteins, C-reactive proteins, and many others. The acute phase response represents a group of physiological processes occurring soon after the onset of infection, injury or trauma, inflammation process, and some malignant process or cancer. It is highly coordinated process which consists of large number of behavior, physiological, biochemical, and nutritional changes. The aim of these changes is to isolate and destroy the infection agent, restore homeostasis, and promote the healing process. So, this is the crux of this whole slide. The aim of these changes is to isolate and destroy the infectious agent, restore homeostasis, and promote the healing process. So, have you understood about the acute phase proteins and acute phase response? Please write in the box. Ram Sarup, Vivek, okay. Acute phase proteins are blood proteins primarily synthesized by hepatocytes acute phase response. So it is synthesized in liver. Where it is synthesized? Where it is synthesized? Where acute phase proteins are synthesized? Please write in the box. APPs are synthesized in liver. Okay, good. The acute phase response begins within inflammatory sites where cells involved in the innate immune response, macrophages, monocyte, you all know, produce and release a vast number of inflammatory mediators among with the cytokines, such as interleukin 1, interleukin 2, and tumor necrosis factor, alpha tumor necrosis factor. So the mechanism of these acute phase proteins are: the acute phase response begins with an inflammatory sites where cell involvement in innate immune response. It releases a vast like cytokines, interleukin 1, interleukin 6, and human necrosis factor. These inflammatory mediators play very important role in this acute phase response. These cytokines influence organs involved in homeostasis, such as central nervous system, autonomic nervous system, and the adrenal gland to establish a rapid and intense protective or reactive response. I just said in the previous slide. APPs may provide alternative means for monitoring animal health. However, the possible influence of inflammatory conditions on the concentration of these proteins and their use as indicators in the detection of various diseases. So these are the biomarkers. These are the biomarkers in veterinary clinical practice, especially in farm animal medicine. So these are the biomarkers for these are important for veterinary. These are important for diagnostic purpose, or we can say these are important clinically for the diagnosis of various diseases. So is it clear now? These are the biomarkers which helps in the diagnosis of various diseases. Now is it clear to all of you? What is the major function of APPs? What is the major function of APPs? Please write in the box. These are the biomarkers. So these are very important for clinical practice or clinical or farm animal medicine. Some of the acute phase proteins like alpha-1 antitrypsin, alpha-2 macroglobulins have anti-protease activity designed to inhibit proteases released by phagocytes or pathogens to minimize damage to normal tissues. So these are acute phase proteins like alpha-1 antitrypsin and alpha-2 macroglobulins. These have anti-protease activities. So these have anti-protease activities. Other APPs like hepatoglobin, serum amyloid A, and C-reactive protein have scavenging activities and bind metabolites released from cellular degradations. Others like alpha-1 acid glycoproteins are characterized by antibacterial activity and by the ability to influence and course of the immune response. So these are the mechanism of various acute phase proteins. Alpha-1 antitrypsin and alpha-2 macroglobulins, these have antiprotease activities. Hepatoglobulin, serum amyloid A, serum C-reactive proteins have scavenging activities, and another alpha-1 acid glycoproteins have antibacterial activity. So types of acute phase proteins or reactants, we can say reactants also. Positive APPs are and negative APPs. So negative APPs, the levels of certain proteins are decreased in the blood in response to certain inflammatory processes. Like you can see here, albumin, pre-albumin transthyretin, we can call it TTR, retinol binding protein, RBP, and transferrin. And what are the positive APPs? The level of certain proteins are increased in blood in response to certain inflammatory processes. Examples are hepatoglobin, serum amyloid A, C-reactive protein, fibrinogen, alpha-1 acid glycoprotein, ceruloplasmins, alpha-1 antitrypsin, and lactoferrin. So these are the positive APPs and these are negative APPs. Now is it clear to all of you what are the positive APPs and what are the negative APPs? Please write in the box. Please write in the box negative and positive APPs. The level of certain proteins are decreased in blood in response to certain inflammatory conditions is called negative, and positives which are increased in blood in response of or in response to certain inflammatory processes. Okay. So positive APPs, they are further classified into major, moderate, or minor, depending on the concentration. Major proteins represent those that increase 10 to 100-fold, moderate proteins increase 2 to 10-fold, and minor proteins are characterized by only a slight increase. So these are three: major, moderate, and minor. Major 10 to 100-fold increase, moderate proteins 2 to 10-fold, and minor slight increase. Event APPs may be observed more often during chronic inflammatory processes or conditions. So please remember, moderate and minor APPs may be observed often during chronic inflammatory processes. Acute phase proteins in ruminants. Very important slide. Diagnostically, the most important acute phase proteins in ruminants are hepatoglobin HP and serum amyloid A, that is SAA. Please remember, in ruminants, hepatoglobin HP and serum amyloid A, SAA. These are important plasma proteins or acute phase proteins for the diagnosis of various diseases. Mastitis: in all cow with mastitis, they found elevated concentration of HP, ceruloplasmins, and anti-alpha-1 antitrypsin in comparison to cows without mastitis. So, in mastitis, most important is HP. SAA, that is serum amyloid A, and HP in bovine respiratory syncytial virus diseases. HPA and SAA are considered the major acute phase proteins in small ruminants. Acid glycoproteins AGP could have a role as a marker for chronic condition in sheep. Multimyeloma, AGP and HP increased, and SAA as a prognostic marker in equine respiratory diseases. HP is a marker of herd status in pigs. So in pigs, HP is important. In equines, SAA important. In cows, again HP important. And in small ruminants, HP and SAA. But in sheep, AGP have a role as a marker for chronic conditions. Acute phase proteins, major and moderate responders in various animal species. So you can see here, these are the various species, major APPs and moderate APPs. Major APPs are in cat SAA, cows HP and SAA. Please remember this HPP and SAA. Dog SCRP and SAA, horse SAA, I just told you. Pig CRP and MAP. So in mastitis, which is an important acute phase protein, please write in the box, in mastitis or for the diagnosis of mastitis, which is the most important acute phase protein? That is hepatoglobin, or we can say HP. Okay, good, very good. Now we will discuss one by one all the plasma proteins. First, we will take first albumin. Human albumin 69 kDa is a major protein of plasma, human plasma or blood. You all know major protein of blood or plasma is albumin. 3.5 to 5 gram per dl concentration. Consists of single polypeptide chain of 585 amino acids with 17 disulfide bonds. It has ellipsoidal shape. So this is a single polypeptide chain of 585 amino acids with 17 disulfide bonds. Makes up approximately 60% of the total plasma protein. About 40% of albumin is present in the plasma, and the other 60% is protein. 60% protein present in the extracellular space. Albumin is exclusively synthesized by the liver. You all know. Albumin is exclusively synthesized by the liver. Liver produce about 12 gram albumin per day. 12 gram albumin per day. Half-life of albumin about 20 days in human. Albumin has an isoelectric pH of 4.7. Please remember this pH, isoelectric pH. 4.7. Migrates fastest in electrophoresis at alkyne pH and precipitates last in salting out methods. So migrates fastest in electrophoresis at alkaline pH and precipitates last in salting out separation methods. So these are the half-life of albumin in various species. Mouse 1.9, rats 2.5, dog 8.2, sheep 14.3, cow 16.5, human around 19 or we can say 20, and horse 19.4. What are the functions of albumin? You all know, but we will discuss one by one. Maintenance of colloidal osmotic pressure. This is the most important function of albumin. Maintenance of colloidal osmotic pressure. Albumin is responsible for 75 to 80% of the osmotic pressure of human plasma due to its low molecular weight and large concentration. So it maintains a colloidal osmotic pressure. It plays a predominant role in maintaining blood volume and body fluid distribution. Hypoalbuminemia. It is an important clinical condition. Hypoalbuminemia leads to or decrease in albumin concentration in plasma leads to plasma or blood leads to retention of fluid in the tissue space. That is called as edema. So what is edema? Please write in the box. Retention of fluid in the tissue space. You might have studied in pathology. What is edema? Please write in the box. What is edema? Retention of fluid in the tissue space. So in edema, which condition is present? Please write in the box. Am I audible to all of you? Please write in the box. In edema, which condition is present? Yes, in edema, which condition is present? That is called as hypoalbuminemia. Hypoalbuminemia. Okay. Decrease in albumin concentration. Other functions of albumin. Transport function. Albumin has an ability to bind various ligands, thus act as transporter for various molecules like free fatty acids, calcium, certain steroid hormone, bilirubin important, copper, a variety of drugs like sulfonamides, penicillin G, dicocumarol, phenotine, aspirin, and also bound to albumin. These drugs bound to albumin. Another functions are nutritive function. Albumin serves as source of amino acids for tissue protein synthesis to a limited extent, particularly in nutritional deprivation of amino acids. Buffering function among the plasma protein and albumin has the maximum buffering capacity due to its higher concentration and the presence of large number of histidine residues, which contribute maximally towards maintenance of acid-base balance, or we can say buffering functions. Viscosity exerts low viscosity. Albumin exerts low viscosity. Please remember this line. Albumin exerts low viscosity. So what are the main functions of albumin? Please write in the box. Maintain osmotic pressure, transport, nutritive functions, buffering function, and viscosity. Please write in the box some important functions of albumin. Please write in the box some important functions of albumin. What is the clinical significance of albumin? You all know this is an important plasma protein. Blood-brain barrier. Albumin-free fatty acid complex cannot cross the blood-brain barrier, that is BBB, you all know. Hence, fatty acids cannot be utilized by the brain. Likewise, albumin-bilirubin complex in the plasma prevents them from crossing the BBB, that is blood-brain barrier. Loosely bound bilirubin to albumin can be easily replaced by drugs like aspirin. In newborn, if such drugs are given, the released bilirubin get deposited in brain, causing kernicterus. You all know this. Kernicterus. You all know icterus. So, what is hypoalbuminemia and what is hyperalbuminemia. Decreased plasma albumin level is observed in cirrhosis of liver. This is an important slide. Cirrhosis of liver, synthesis is decreased, albumin synthesis is decreased by liver. Malnutrition, availability of amino acid is reduced, and so albumin synthesis is affected in liver. Nephrotic syndromes like permeability of kidney glomerular membrane is defective. Albumin is exceeded in large quantities. So again, it leads to decreased albumin concentration. In burns also, since albumin is the major protein present in the blood, any condition causing lowering of albumin will lead to reduced total plasma proteins in blood. So when albumin is decreased, because it imparts the major protein portion, or it forms a major protein portion, it leads to reduced total protein concentration in blood. It is called as hypoproteinemia. So hypoalbuminemia or hypoproteinemia. And albuminemia, very low amount, it is found in congenital disorders. And hyperalbuminemia, this increase in plasma albumin concentration. This condition is present in fluid depletion, or we can say hemoconcentration. That is acute dehydration or shock. So in the case of acute dehydration or shock, hemoconcentration or hypoalbuminemia is present because there is fluid depletion or hemoconcentration. Now, is it clear to all of you? Hypoalbuminemia and hyperalbuminemia. You have to remember this hypoalbuminemia in the conditions of cirrhosis, liver of cirrhosis, malnutrition, nephrotic syndrome, burns. And this hyperalbuminemia is present in acute dehydration and shock, or in the condition of hemoconcentration. So please add in the box. Have you understood about hypoalbuminemia and hyperalbuminemia? Please add in the box. Am I audible to all of you? Please add in the box. Okay. Is it clear to all of you? Hypoalbuminemia and hyperalbuminemia. You have to remember the conditions. So hypoalbuminemia, liver cirrhosis, malnutrition, nephrotic syndromes, and burns. And hyperalbuminemia in high hemoconcentration or in the acute dehydration and shock. What is albuminuria? Presence of albumin in urine is called as albuminuria, and it is always pathological. Large quantities of albumin is lost in urine in nephrotic syndromes. Small quantities are lost in urine in acute nephritis and other inflammatory conditions of urinary tract. Hyperproteinemia. So, what is hyperproteinemia? Level higher than 8 gram per dl. This is total protein. So, increased concentration of total protein is called as hyperproteinemia. Causes hemoconcentration, as I just told you in the case of hyperalbuminemia. Due to dehydration, albumin and globulin both are increased, but albumin to globulin ratio remains same. These are the examples: excessive vomiting, diarrhea, diabetes insipidus, pyloric stenosis or obstruction, diuresis, and intestinal obstruction. What is hyperproteinemia? Decrease in total protein concentration. We have just read it is present in hemodilution. Both albumin and globulins are decreased, but AG remains same. We will discuss it later, this AG ratio, as in water intoxication. Hypoalbuminemia, this is low level of albumin in plasma. Examples are nephrotic syndromes, protein losing enteropathy, severe liver diseases like liver cirrhosis, malnutrition or malabsorption, extensive skin burns, as I just told you, pregnancy, and in the case of various malignancies. This albumin globulin ratio. What is this AG ratio? In hypoalbuminemia, there will be a compensatory increase in globulin, which are synthesized by the reticuloendothelial system, that is RE system. AG ratio is thus altered or even reversed. So what is this AG ratio? A upon G. In the case of hypoalbuminemia, A is decreased and G will be increased. And just reverse, in the case of AG ratio decrease, it means A is decreased and G increased, and when AG ratio increased, A is increased, A will be increased and G will be decreased. In the case of hypergamma-globulinemias, low albumin level, when albumin level is decreased, body tries to compensate by increasing the production of globulins, as I just told you, from RE system. In the case of chronic infections, gamma globulins are increased. In the case of multimyelomas, decreased in paraproteinemias. When a sharp spike is noted in electrophoresis, this is termed as M band. The monoclonal origin of immunoglobulins are seen in multiple myeloma, you all know. So, this is AG ratio and this is the case of hypergamma-globulinemias. When gamma-globulinemias increases, globulin increases, and globulin increases, low albumin level. It leads to decrease in albumin concentration. Now, is it clear to all of you? We will discuss it later also. Globulins. Globulins are separated by half saturation with ammonium sulfate. Molecular weight ranges from 90,000 to these 13 lakhs. Globulin consists several proteins that are separated into 4 distinct beds: alpha 1, alpha 2, beta and gamma globulins on electrophoresis. These are synthesized, alpha and beta are synthesized in liver. I just told you gamma globulins are synthesized by plasma cells and beta cells of lymphoid tissues by reticuloendothelial system, RE. This is the exception. All other globulins are synthesized in liver. Now is it clear? Alpha globulins. They are glycoproteins and are classified into, again, alpha 1 and alpha 2 depending on the electrophoretic mobility. So first is alpha 1 acid glycoproteins, also called as orosomucoid. Its carbohydrate content is about 41%. Orosomucoid is considered to be a reliable indicator of acute inflammation. Please remember, this is a reliable indicator of acute inflammation. Orosomucoid binds the hormone progesterone and function as transport protein for this hormone. So, for the transportation of progesterone hormone, orosomucoid or alpha-1 acid glycoproteins is essential. Transport carbohydrate to site of tissue injuries. Alpha-1 acid glycoprotein increased in various conditions like acute and chronic inflammatory diseases, cirrhosis of liver, malignant conditions. And it is decreased in low concentration or decreased in generalized hypoproteinemic conditions, hepatic diseases, malnutrition, and nephrotic syndromes. Another globulin is alpha-1 fetoprotein. It is present in high concentration in fetal blood during mid-pregnancy. Normal adult blood concentration below 100 microgram per dl. It may increase during pregnancy. Useful in determining the hepatocellular carcinoma, or we can say teratoblastomas. So, this is alpha-1, we can say alpha-1 anti-proteases. Synthesized by hepatocyte and macrophages, it is a single chain proteins of 394 amino acid, contains 3 oligosaccharide chains. This is glycoprotein, highly polymorphic in nature, major component 90% of the alpha-1 fraction. The major function of this alpha-1 antitrypsin is, this plasma protein is inhibitor of serine proteases, inhibits trypsin and elastase. So alpha-1 AT deficiency is related with liver diseases due to accumulation of mutant alpha-1 AT, which aggregates to form polymers. These polymers causes liver damage like hepatitis. followed by the accumulation of collagen resulting in fibrosis. So it leads to cirrhosis. Alpha-1 AT deficiency leads to liver diseases. A deficiency of this protein has a role in certain cases of emphysema. So it is important in emphysema and liver diseases. Its deficiency is very important in the case of liver diseases, liver cirrhosis, and emphysema. Alpha-1 AT has been used as a tumor marker, increase in germ cell tumor of testes and ovary. Alpha-2 globulins. First example of this alpha-2 globulin is ceruloplasmin, you all know, also called as ferrooxidase, an enzyme which helps in the incorporation of iron into transferrin, carries 90% of copper in plasma, copper cofactor for a variety of enzymes. It is a copper containing alpha-2 globulin, a glycoprotein with enzyme activities. It is synthesized in liver where 6 to 8 copper atoms are attached to a protein that is called as apoceruloplasmin. Albumin may be more important in copper transport because it donates copper to tissue more readily. It is decreased in the condition of various liver diseases, in particular Wilson's disease, that is called as hepatolenticular degeneration. You all know about hepatolenticular degeneration. This is a genetic disease in which copper falls to be exerted into the bile and accumulates in liver, which is required for copper excretion from cells. This ceruloplasmin is also decreased in malnutrition and nephrotic syndrome. Ceruloplasmin concentration increased in inflammatory status or inflammatory conditions, carcinomas, leukemias, and rheumatic arthritis, RA. So main or most important diseases, Wilson disease, hepatolenticular degeneration. So the another name of this Wilson disease is, please write in the box, other name of this Wilson disease caused by the deficiency of ceruloplasmin. Please write in the box the another name of this Wilson disease. Please write in the box the other name of this Wilson disease, which is caused by the deficiency of ceruloplasmin. Yes. Okay. Another alpha-2 globulin is alpha-2 macroglobulin, AMG. It is a high molecular weight protein. Tetrameric protein, it's a major fraction of alpha-2 fraction, comprises 8 to 10% of total plasma protein in humans. This inhibits protease activity and serves as anticoagulant. Its concentration in plasma is elevated in nephrotic syndromes, synthesized in hepatocytes and macrophages. The important acute phase protein is hepatoglobin, that is represented by this HP. Hepatoglobin is a plasma glycoprotein with an approximately molecular weight of 90,000. This is an acute phase protein composed of 2 alpha chain and only 1 beta chain. The half-life of this HP is about 5 days, while that of HP-HB complex, hemoglobin complex is 90 minutes. It is synthesized in liver by hepatocytes and a very small extent in cells of RE. Hepatoglobin binds with the free hemoglobin known as extracorpuscular hemoglobin in a tight non-covalent complex that spills into the plasma due to hemolysis. The hepatoglobin hemoglobin complex cannot pass through the glomeruli of kidney where free HB, while free HB can. So hepatoglobin prevents the loss of free HB into kidney, and thus HP helps to conserve iron. This is the most important thing. Thus HP helps to conserve iron. Hemolytic anemia is associated with decreased plasma concentration of hepatoglobin. In hemolytic anemia, free HB in plasma is elevated, leading to increased formation of HP complex. This complex is readily cleared from the plasma, resulting in decreased HP levels. HP concentration rises in various inflammatory conditions. Beta globulin, first example is transferrin. You all know it is a non-heme iron containing protein. Glycoprotein, protein part is apotransferrin. A single chain polypeptide can bind 2 atoms of Fe to form transferrin. Transport iron 2 moles of Fe3 plus per 1 mole of transferrin. Site of synthesis is liver. It is increased in serum iron deficiency anemia and in last month of pregnancy, and it is decreased in protein, malnutrition, cirrhosis of liver, nephrotic syndrome, myocardial infarction, and various malignancies. C-reactive protein, CRP, is an important acute phase protein, major component of acute phase protein, produced in the liver, and its concentration is around less than 1 milligram per dl. C stands for carbohydrate. Please remember this C, C-reactive protein, C for carbohydrate. So please write in the box, C stands for, in CRP, C-reactive protein, please write the C, write the C-reactive protein, C stands for what? Carbohydrate. CRP is a beta globulin and has a molecular weight of this 115 to 140 kd. It can stimulate complement activity and macrophage phagocytosis. This is the important function of this C-reactive protein. It can stimulate complement activity and macrophage phagocytosis. CRP level, especially high sensitivity CRP level in blood, has a positive correlation in predicting the risk of coronary artery disease. It is a very important marker for the coronary artery disease, clinically important marker for risk of coronary artery diseases in humans. APP, serum amyloid A, that is also called as SAA, member of apolipoprotein family. We will study later. It has pentameric structure. It has a role in the inflammation process. During inflammation, it binds to HDL and alters the cholesterol metabolism. SAA affect the addition of phagocytic cells and lymphocytes and is responsible of their chemotaxis. So these are the major acute phase proteins and their functions. CRP binds pneumococcal cell wall, ceruloplasmin copper transport, antiprotease inhibits protease inhibitors, AAG tissue repair, fibrinogen blood clotting, hepatoglobin binds hemoglobin and prevents its loss in the urine. It prevents or it preserves the hemoglobin. Gamma globulins. You all know about these gamma globulins. They are immunoglobulins with antibody activity. They occupy the gamma region on electrophoresis. Immunoglobulins play a key role in defense mechanism of the body. There are 5 types of immunoglobulins: IgG, IgA, IgM, IgD, and IgE. These are the major immunoglobulins and their functions. You all know about these. IgG, secondary response, then opsonizes bacteria, fixes complement, neutralizes bacteria toxins, virus causes the placenta. IgA, secretory IgE, prevents attachment of the bacteria and virus to the mucous membranes. Then IgM, primary response to an antigen, fixes complements. IgD, found on the surface of many B cells. IgE mediates immediate hypersensitivity, defense against worm infections, and important in various allergic conditions. Fibrinogen, also called clotting factor 1. So, what is another name of this fibrinogen? Please write in the box. What is another name of this fibrinogen? Clotting factor 1. Okay. Constituent 4 to 6% of total protein, precipitated with 1/5 saturation with ammonium sulfate, large asymmetrical module, highly elongated with axial ratio of 21, imparts maximum viscosity of blood. This is an important point, imparts maximum viscosity to blood. Synthesized in liver, made up of 6 polypeptide chains. Chains are linked together with SS or disulfide linkages. Amino terminal end is highly negative due to presence of glutamic acid. Negative charge contributes to its solubility in plasma and prevents aggregation due to electrostatic repulsion between the fibrinogen molecules. So it is also called as clotting factor 1. Ben-Jones protein is the example of abnormal protein, monoclonal light chains present in the liver, urine of a patient suffering from multiple myeloma. So it is a biomarker of multiple myeloma, identified by a heat coagulation test, best detected by Jones electrophoresis and immunoelectrophoresis. So this is monoclonal light chains, abnormal protein, this Ben-Jones protein. So this is a summary of important plasma proteins: albumin, plasma levels, so plasma concentration, molecular weight. So fibrinogen, here you can see 69,000, globulin you can see here, and fibrinogen maximum or more molecular weight, 4 legs or 5 legs. They are all synthesized in liver. Albumin half-life 20 in human. Please correct it, this half-life. What is the dysproteinemias? So last topic of this class is dysproteinemias. Classification of dysproteinemias based on this albumin to globulin ratio and the serum protein electrophoretic profile. This is also called as SPE profile. So what is this? Serum protein electrophoretic profile. Normal AG, here normal AG means albumin globulin ratio, normal SPE profile. Hyperproteinemia, you all know, dehydration. I have just summarized these slides. Hypoproteinemia, overhydration, acute blood loss, external plasma loss, and internal plasma loss. So this is the category of normal AG and normal SPE profile. Decreased AG or abnormal SPE profile means decreased A and increased globulin. In the case of decreased albumin, various condition, glomerulonephritis, nephrosis, decreased synthesis of albumin in chronic liver diseases, malnutrition, and various chronic inflammatory diseases. These decreased albumin, increased globulin, these are categorized in this category B, decreased AG or abnormal SPE profile. Increased globulin, there may be many conditions like increased alpha-1 globulin in acute anti-inflammatory diseases, acute inflammatory diseases, alpha-1 antitrypsin, alpha-1 acid glycoprotein, and another is increased alpha-2 globulin. It is present in acute inflammatory diseases, severe acute hepatitis, acute nephritis, nephrotic syndromes, and various other diseases. A is, you can see here, A is decreased albumin, B is increased globulin, C is increased beta globulin. It is present in acute hepatitis, nephrotic syndromes. Then another is bridging chronic active hepatitis, increased gamma globulin. There's polyclonal gammopathies like IgG, IgM, IgA, and various chronic hepatitis, hepatic abscess, immune-mediated diseases or autoimmune diseases, and hemolytic anemias. Lastly, lymphoid tumors. Increased gamma globulin, you can see in monoclonal gammopathies, again, lymphoid tumors, macroglobinemias, canine, and this benign tumors. Then increased AG or abnormal profile, again, increased AG means albumin increased and globulin decreased. So increased albumin does not occur except in dehydration, you all know, and decreased globulin presents condition present in fetal serum, cholesterol neonates, combined immunodeficiency of Arabian falls, and a gamma globinemias. So these are the various conditions. You have to remember all these conditions under dysproteinemias. So what is dysproteinemia? Please write in the box. What is the definition of dysproteinemia? Please write in the box what is dysproteinemia. Please write in the box what is dysproteinemia. Abnormal albumin globulin ratio or serum protein electrophoretic profile. Please write in the box what is dysproteinemia. Am I audible to all of you? Please write in the box what is dysproteinemia. Yes, abnormal Ag ratio, it may be on, or it may be abnormal serum protein electrophoretic profile. It is called as SPE profile. Okay, so in the case of normal Ag, you can see Ag ratio doesn't change, so hyperproteinemia in the condition of dehydration, hypoproteinemia, overhydration, acute blood loss. Here this hyperproteinemia, dehydration, hyperproteinemia, overhydration or acute blood loss. And in the case of abnormal, you can see here decreased and increased Ag ratio. So decreased Ag ratio, decreased albumin and increased globulin. It may be alpha 1, alpha 2, beta or gamma. And in the case of increased Ag ratio, here albumin is increased except dehydration and decreased globulin in various conditions like fetal serum and gamma globinemias. So now is it clear to all of you? I will summarize whole of the topic or today's class. What is dysproteinemia? Please write in the box what is dysproteinemia. Am I audible to all of you? This topic is very important for your examination purpose in the section or the unit of veterinary analytical biochemistry, unit 3rd. So what is APP? Please write in the box. Examples of APP. What are the examples of APP, acute phase proteins? Please write in the box. I will summarize the whole presentation. So what is plasma and serum? You all know plasma is plasma minus clotting factors, and this is serum, plasma minus clotting factor, and plasma is blood minus cellular element. You all know plasma, difference between plasma and serum. Plasma is blood minus cellular elements and serum is plasma minus clotting factors. This is the composition or this is the component. These are the components of plasma. Water approximately 91%, organic 9%, inorganic around 1%. Plasma proteins, major plasma proteins are albumin, globulins and fibrinogen. Usually ratio 1.2 to 1 or 1.5 to 1. Almost all plasma protein except immunoglobulins are synthesized in. These are the major common serum proteins, functions and their characteristics occurs in various diseases. Pre-albumin, transthyretin, albumin, these are alpha 1, alpha 2. This is beta globulins, beta 1 and beta 2. These are gamma globulins. You all know immunoglobulins, IgG, IgA, IgE, IgM and Ig. Then this is light chain Benzstone's proteins, abnormal proteins. These are the important fractions of plasma proteins: albumin, alpha globulins, alpha 2 globulins, beta globulins, gamma globulins. Separation by two methods, salting out or electrophoresis. The salting out by ammonium sulfate. This electrophoresis. Functions of plasma protein, you all know: blood coagulation, maintenance of homeostasis, defense against infection, transport of various compounds, and these are synthesized in liver except gamma globulins. Transport by various proteins. This fatty acid, bilirubin, hormones, calcium, heavy metals, drugs are transported by albumin. This thyroxine is transported by transthyretin. Then this cortisol and corticosteroids are transported by transportin, hemoglobin by hepatoglobin, iron by transferrin, cholesterol by HDL and LDL. What are these acute phase proteins? Non-specific response to the stimulus of infection, injury, and inflammation. 3 I's. You have to remember 3 I's. So these proteins are involved in acute phase responses to the stimulus of injury, infection, and inflammation. The aim of these changes is to isolate, destroy the infectious agents, restore homeostasis, and promotes the healing process. These are synthesized in liver. These are the biomarkers of various diseases. Negative APPs, concentration decreased. Positive APPs, concentration increased in blood in response to various inflammatory conditions. Positive APPs are further divided into major, moderate, and minor. In mastitis, HP is important. SAA, HP in bovine respiratory syncytial virus diseases. Multiple myeloma, AGP and HP increased. These are the major APPs and moderate APPs in various species. You can see here cow, HP and SAA. Albumin, you all know about albumin. This is a major protein of human plasma or protein. Isoelectric pH 4.7. Functions of albumin, you all know: maintenance of colloidal osmotic pressure, nutritive function, buffering functions, viscosity, and transportation of various compounds. Clinical significance of albumin, you have to remember this: hypoalbuminemia, present in cirrhosis of liver, malnutrition, nephrotic syndromes, burns, and this hyperalbuminemia present in hemoconcentration or present in acute dehydration and shock. What is albuminuria? Presence of albumin in urine, present in nephrotic conditions. Hyperproteinemia by hemoconcentration, dehydration. Hyperproteinemia, you all know. Here, AG ratio remains same. In the case of hemodilution, hypoalbuminemia, nephrotic syndromes, burns, pregnancy, malnutrition. AG ratio. Globulins, alpha 1, alpha 2, beta, and gamma globulins. Gamma globulins are synthesized by plasma cells and beta cells of lymphoid tissues. Alpha globulins, alpha 1 acid glycoprotein, or also mucoid, important for the transportation of progesterone hormone and reliable indicator of acute inflammation. Alpha 1 phytoprotein, important in teratoblastomas, for a biomarker for the teratoblastomas. Alpha 1 antitrypsin, its deficiency is associated with liver diseases and emphysema. Alpha 2 globulin, ceruloplasmin, very important, ferroxide. Its deficiency is important in liver diseases like Wilson disease, hepatolenticular degeneration. Alpha 2 macroglobulin inhibits protease activity. Hepatoglobin important because it conserves HP, helps to conserve iron. It conserves iron, or hepatoglobin prevents the loss of free hemoglobin into kidney. Deficiency diseases, hemolytic anemia. Beta globulins are transferrin, non-heme iron containing protein. C-reactive protein, it's acute major component of acute phase protein. It can stimulate complement activity and macrophage phagocytosis. APP, another APP, this serum amyloid A, SAA, member of apolipoprotein family, important in inflammatory processes and cholesterol metabolism. Gamma globulins, you all know: IgG, IgA, IgM, IgD, and IgE. Fibrinogen, clotting factor 1. It is important because it imparts maximum viscosity to blood. Abnormal protein, Bence-Jones proteins, light chains, important in various multiple myeloma. What is dysproteinemia? Is the abnormal AG ratio or abnormal serum protein electrophoretic profile. This decreased AG ratio when albumin is decreased and globulins are increased. Alpha 1, alpha 2, beta and gamma. All will be increased. And in the case of increased AAG ratio means A is increased, albumin increased and globulins decreased. Here you can see. So have you understood the whole protein, plasma proteins, dysproteinemias and acute phase proteins? Please write in the box. Have you understood? Now is it clear to all of you? Please write in the box. Am I audible to all of you? Okay. Now you have some idea about the clinical biochemistry or analytical biochemistry. Please write in the box. Now you will have some idea about the analytical biochemistry or clinical biochemistry. Is it clear to all of you? Priyanka, Sonali, is it clear to all of you? Nisha, Himanshu. Okay. Thank you very much. Thanks once again.